Great. Thanks for being with us today. I'm Helen Jung. I'm the opinion editor with the Oregonian. On the line on the call, we have two other members of the editorial board. If Therese, you want to start off by introducing yourself.
Hi, Therese Bottomley, editor of the Oregonian and Oregon Live. Thanks for taking the time today.
Nice to meet you.
And Laura.
Hi there, Laura Gunderson with the Oregonian, Oregon Live. I'm the Director of Public Interest and Accountability, which means kind of I oversee our newsroom reporters, and I also serve on the editorial board.
Great, and we're here with the candidates for House District 33. And if each of you can just kind of introduce yourself and tell us why you're running for office and why voters should vote for you. Let's start off with Maxine going first.
Great. So as you said, my name is Maxine Dexter. I am a physician, a mom, and a concerned citizen who's really excited about this opportunity to serve. I am really dedicated to making policies that are people-focused, and really the outcome is healthy lives, healthy communities, and in a healthy environment. I grew up in a working-class family and am the first and only person to go to college. And that opportunity was really made for me by a resilient community who had a great education system and the supports that went with it, and a family who was willing to kind of dream big and helped me along the way. A union job at 16 gave me the full benefits and a great wage that I was able to leave home because there were some challenges there from a mental health perspective that allowed me to kind of live up to my potential and pay my way through state university and medical school. So I'm really grateful for the governmental and community benefits that I received, and I desperately believe that every person needs to have the same supports to achieve their dreams and their greatest potential. I want to be elected to help make sure that can happen.
Great, thank you very much. And Andy, can you tell us a little bit about yourself?
Sure. Thank you so much for having me. I really appreciate you taking the time, especially during nap time, because my 3- and 2-year-olds are upstairs sleeping. My name is Andy Saultz. I'm an educator, a father, and longtime resident of Cedar Mill. My wife and I actually started dating when we were 16 years old at Sunset High School, and we are raising our 2 boys in the community that we grew up in. The ultimate measure of a community is if people want to move back there to raise their family. For my partner and I, that was a no-brainer. We had wonderful schools, a clean environment, and safe neighborhoods. I'm concerned about the next generation. Our public schools have the 2nd worst high school graduation rate in the country. Our healthcare costs are through the roof, and we have to do something about lowering healthcare costs. And our traffic, particularly in the Cedar Mill and Bethany areas, is really out of hand. I've spent my career in education. I started as a high school social studies teacher. And then I got really interested in how to improve a system that I felt like was not addressing all kids' needs. So I ran for my school board. This is when my wife was going to medical school out at Michigan State, and served on a school board during the Great Recession and really learned a lot about budgeting during difficult economic times. I'm currently a professor of education policy out at Pacific University and the director of the PhD program in education leadership. I am running to rebuild our economy and to help us recover out of this pandemic. And I bring a unique skill set as having worked in the Senate Fiscal Agency in the state of Michigan, having served in public office during the Great Recession, and teaching quantitative methods at the doctoral level. I'm a budget wonk, and I think that experience is going to be really important as the 2021 session is really defined by economic recovery. So thank you again. It's wonderful to be here, and I look forward to your questions.
Great. That segues very well into my first question, which goes to you, Andy. And we'll just kind of alternate back and forth. It's unknown just how much the pandemic and the stay-home order are going to cost the state in tax revenue, or how deeply the economic impacts will cut. Can you give a couple of ideas of what you think the legislature should be doing next to help individuals and businesses get through this?
Thank you so much, and I will try to keep my comments brief, but obviously this is a complicated question. Eco Northwest came out with a report and did a really good job about framing this as a 3-cycle problem. We have the shutdown, we have a reopen, and we have a recovery. I think the legislature should have task forces that are vertically integrated to address each of those. My hope is we can start reopening in the coming months. I think in that phase, focusing a lot on testing, the availability of testing, and getting results quickly. My wife actually was tested for COVID, and we had to wait 8 days for the results. And we have to do a better job about getting quick responses. The other part in the reopen that I think is really important is making sure that our frontline workers have PPE and are protected. Again, testing is rapidly available, and we're doing a good job as leaders communicating, because what I hear from citizens is a lot of uncertainty about what is allowed and what isn't allowed. I think as we start to reopen, it's going to be really important to define where we're drawing the line and why. And then finally, the recovery, which my hope, I think we're going to be kind of in and out of these phases, and it's not going to be completely linear, but my hope is the 2021 session will be about economic recovery. When I was on a school board, we had a 10% budget cut followed by an 11% budget cut during the Great Recession. And so I think during economic recovery, the important part is really involving the public in the budgeting process, prioritizing basic needs, that is food security, healthcare, housing security, and really trying to consolidate administrative costs and reducing kind of middle management levels. So on the school board, we were able to close a school and reduce some of our administrative costs, while at the same time shifting costs to more professional development as teachers were assuming new roles. And so I think that experience is going to be really, really important as we think about delivering our school system in a really unique way, as we might have to go in and out of these different phases.
Great, thank you very much. Maxine, would you like the question repeated?
No, I think that I can take it. So thank you so much again for asking this, because this is absolutely the pivotal question for the 2021 session. I think we need to focus on people. It really is simple. You can't have an economy without healthy people to participate in that economy. And people are going to be concerned about engaging in the economy if they don't feel protected and safe. So as a healthcare provider who is deciding who gets tested every day and trying to help implement the strategies that we have, what is clear to me is that we need broad testing capabilities, and we need to really build on relationships with our care delivery systems that the state doesn't already have infrastructure to do. There are a lot of individual delivery systems that aren't necessarily empowered with the same testing capabilities and infrastructure supports, whether we're talking about PPE, whether we're talking about staff. There's a lot that the state can help do by creating guardrails. So when we open the economy, we have to be sure that, one, people are safe and can get tested and know that they can participate in a manner that not only protects themselves, but everyone around them. And two, when they get sick, we need to be able to identify where they contracted the illness, have public health workers who can be tracers that we have underinvested in public health for over 30 years. We need to reinvest in that, and that's where we can start putting people to work right away, is really rebuilding our public health infrastructure. And then working families, housing, the loss of jobs, where are those relief funds going, whether we're talking about the PPP or other federal relief funds, how are those being delegated? We don't have tremendous control over that, but we do have the ability as a state to help make sure that those are going to the appropriate, most impactful groups, whether it's businesses or individuals. And we need to help facilitate the supports around those families so that they can be safe. When we open up schools again, there is an enormous likelihood that we will have to have rolling shutdowns. So what are the rules under which we are going to pull the plug on schools and the economy again? I think it's much better to be prepared for that question than to try to figure it out as we go. So before we open, we should have, safety structures set in place that over a certain threshold, we're going to have to shut things down. And that may be based on schools, that may be based on districts, counties. We need to really be thoughtful about how we do this. And as a healthcare and public health expert, I'd like to be part of that.
Great, thank you very much. And Maxine, this question will go to you first. Even with federal assistance, Oregon's needs will likely far outstrip the revenue it's going to bring in. What, if any, changes to Oregon's tax system would you support to bring in more revenue or bring it from different sources?
We are really regressive in our tax structure. Our federal or our state income tax, property tax, our whole state generated revenue system is in need of overhaul. And when we are at this very critical moment, it seems like a very good opportunity to take a step back and reconfigure ourselves so that we do put people at the center. It is egregious to me that our second largest state income source is a state lottery. There isn't much more regressive than that, $1.4 billion from that. We need to be thinking holistically and strategically about resilience as a state and as a nation, but what we can own at the legislature level is certainly what we do as a state. So reconfiguring taxation, yes, we have our corporate activity taxes and different specific policies to look at, but I think we need to take a step back and really look at what are the principles of our tax system right now and how do we readjust.
So in terms of our income tax, though, it is progressive. I mean, the brackets certainly start very, very low. But it does, you know, in terms of like, especially with comparison to a sales tax, which is often criticized for being regressive, our income tax does increase as income levels go up. So I guess, what are, you know, yes, looking at the system, but is there anything specific that you would look at, or, you know, would you look at a sales tax, or what kind of, you know, other changes might you think would be worthy of discussion?
Absolutely. So number one, we need to get rid of the kicker. I think not being able to save for a rainy day when we've had years of recovery is going to really hurt us right now. So absolutely, I think that we should change that policy. I do believe that we should not continue our mortgage interest deduction at the state level for income earners at our highest echelons. We see people being priced out by our property tax structure, even though they've owned their home for a generation or more, as our property tax levels. And that's, of course, on the local level, but that again plays into with the caps and the compression due to Measure 5 and different outcomes, we do have limitations on what we can do. So I think and some of this obviously is going to have to go to the voters for approval, but really kind of prioritizing education and reinvestment in affordable housing. As we know with our housing measure that's before us, you know, we're really leaning again on high earners and corporations, and that is consistent, I think, with a progressive platform, and yet it doesn't help those folks who still can't afford property taxes. That is a huge aspect of our state's budget on the more local level.
Great, thank you. Andy, would you like me to repeat the question?
Yes, please.
Okay.
You're going back to the original question of the
Yes,
policy.
the original, yes.
I appreciate it.
Even with federal assistance, Oregon's needs will far outstrip the revenue it brings in. What, if any, changes to Oregon's tax system would you support to bring in more revenue or tap different sources?
Yeah, thank you for this question. Again, I feel like the last decade I've spent a lot of time with public budgets, really understanding how to navigate difficult economic situations. Throughout this campaign, I've received really broad support. So I have a coalition from the United Farm Workers to the Oregon School Employees Association to the Beaverton Chamber of Commerce, which is the only chamber of commerce who is endorsed in this race. And I've really focused on listening to individuals and small businesses. what I'm hearing through this pandemic is a struggle with cash flow at the individual level and with small businesses. And so I think we have to be really careful. We just had a huge ask of business to increase business tax through the CAT tax by about $1 billion. What I think we can do is potentially expand some of the labor deductions within that, because we need to incentivize people to keep people in jobs. So I think we need to look at the payroll tax and the labor deductions embedded within the CAT tax as a way to really help with cash flow in particular. I also will advocate for a second federal stimulus that does help backfill some state and local money. I know during the Great Recession that was really important for us as a school board. I would just say, I think we really, really need to be careful about changing the revenue situation. My understanding is the economic forecast that'll come out right after, actually the week of the primary, we're looking at about $2 to $3 billion shortfall. Now, the good news there is we had a short session that didn't really happen. And so about $600 million were saved that I think the legislature was planning on spending. Obviously, that session did not end well. However, some of that money can roll over. So even though we're looking at potentially a $2 to $3 billion shortfall, I think it'll be lessened by some of the savings that we had from that. This is all, suffice to say, I am a budget nerd. I teach quantitative methods and statistics. I'm really excited about getting into the budget and working with the community, because our budget decisions reflect our values, and we're going to be really pushed to limit our spending and make sure that small businesses and individuals have that cash in their pockets.
Great, thank you. Would you, just to follow up a little bit more, would you support, for instance, looking at a sales tax or anything, or getting rid of the kicker or something more structural like that?
Yeah, so I think our tax system structurally is not sound, and there are some long-term things I would like to do. You mentioned our income tax, and we have 4 tax brackets. If you look at it, almost 70% of individuals pay that 8%, 8.9%, that third tax bracket. California, for example, has 10 tax brackets. So I think we could stagger it more. I have a full tax proposal on my website. We're actually rolling out 2 or 3 really detailed policy proposals per week. So I encourage people to go to my website at andyfororegon.org if you want to see my proposals. I would stagger the income tax more over a long haul, make it more progressive. I think our property tax has been really piecemeal, and as a result, neighbors are paying really dramatically different rates. I don't think that's equitable. I think it leads to a lot of perverse incentives. So I think there are some structural things we can do. I just think the priority right now has to be economic recovery, and we have already altered our tax structure pretty significantly in recent times. And what I'm hearing from small business leaders is really wanting continuity in their taxes and certainty about what they're going to be paying. So I think we have to just be a little bit careful about manipulating too much of these in the midst of a recession or at least significant economic downturn.
Great, thank you. Actually, Laura or Therese, do one of you want to jump in with anything?
Yeah, as soon as I find my mute button. So analysts had warned the legislature's decision to delay the repayment of the pension system's $25 billion unfunded liability would put the fund at greater risk in the event of a recession. Stocks have plummeted, and we are almost certainly in a recession now. So I believe this question goes to you, Maxine. What, if anything, do you think we should do to tackle this public finance crisis?
And actually,
or am I wrong?
It goes to Andy.
I'm always, sorry about that, yeah.
Well, I appreciate this question. And when I look at our unfunded liability, a lot of people made really poor financial decisions, and most of those people are not involved in politics anymore. And so I think the challenge and what our campaign has really tried to do is focus more on the long-term health of our community and our state. And unfortunately, our political system right now is really incentivizing these short-term behaviors that are compromising our long-term fiscal health. So from my perspective, I don't think it's okay to shift that responsibility. The amortization, most of the savings from what happened last session were, as you say, just really putting off a payment schedule like refinancing your house. I think we have to prioritize this. I think we have to pay down our debt. I want to return to the kicker discussion. If I had credit card debt, luckily I do not, but if I had a lot of credit card debt and I got a bonus at work, I would not go spend that bonus. I would pay down the debt. And so I think as I think about the PERS discussion, we're just really putting together a 2-year budget, ignoring the longer term. And again, as a father of a 3-year-old and a 2-year-old, I don't think 1 to 2 years from now. I think 20 years from now in terms of my family's financial health. And I think we need to shift that a little bit from a state perspective and have a 5, 10, and 20-year plan, financial plan. And I just have not seen that kind of meticulous planning and fiscal management at the state level right now.
Thank you for that. Maxine, would you like me to read the question again?
No, I think what I'd like to say is that we do have a recession ahead of us, and we probably are in it, and we all are seeing that impact. Those of us who are fortunate enough to have retirement savings plans. And so 100% I agree that we need to manage that. That being said, only 1/3 of that current liability is based on current workers. So as we manage this, we will be able to continue to evolve the system. So right now, I do not believe that we should be making dramatic changes. We need to manage the investment strategy that we have and continue to look for the long-term investment. I don't believe that short-term changes make sense during the midst of a recession. It's just not the right time. I think holding tight and waiting, hoping that those who have adjusted our investment strategies more recently have shifted to a more sustainable return. I do absolutely think that our workers are going to be suffering, and again, we need to have people who can engage in an economy. So we really do need to focus on keeping people and financially cash in their accounts right now, and so there shouldn't be a change as far as that goes.
So I guess, do I hear you saying you don't see a need for any further reforms, that you're hoping what is being done through IC is enough to address the long-term strategies of the PERS fund?
I am not saying that there won't need to be ongoing discussions. I know that there have been discussions about, changing the plan base and the strategies. I would not say that we shouldn't have those discussions. I just don't think shifting investment in the midst of a recession makes sense unless you have the capital to do that. And in a short term, that's not the case. The state doesn't have increased capital, and so shifting when things are at a low doesn't make sense in my mind.
Okay, great. Let's see, this question goes to Maxine first. Would you support moving forward with a cap and trade program in the 2021 session?
I honestly think that our focus needs to be on healthcare reform. I 100% believe that investing in environmental protection is part of a holistic health strategy. We know very clearly that dirty diesel impacts on a real-time basis on health outcomes, whether, so I do believe that the cap and invest principle is important. Do I think that specific policy is the right one? I believe that it may be. We've seen what people can do in, unprecedented crisis, and we should build on the gains that our environment has benefited from during this period of time. I hope that we can reconsider the positions that we took and potentially be even bolder with some of what we're doing. I'm not sure that I agree with all of the policies as they stood. So building on it, but not with the exact policy. That being said, healthcare reform is 27% of our state's budget goes into healthcare. And we know that at least 30% of that could be saved if we streamline the system. And at each level, it's a very complex hierarchy of invested interest groups and companies. If we could simplify the system so that we don't have margins being needed at every level, we could save at least 30% of that to reinvest in public health strategies. And that would include clean air, clean energy, and I believe investment in early education, because those who are educated will make better health choices for themselves. So looking at the social determinants of health as part of that really is holistically where we need to head.
Great, thank you. Andy, question for you is, would you support moving forward with a cap and trade program in the 2021 session?
I would. I support a cap and invest system, and again, detailed policy proposal on my website at andyforwork.org. I think last session we got really too complicated with that bill. In fact, there were only 2 legislators who looked me in the eye and said, I absolutely understand every component of this bill. And so for the public out there, I think people couldn't keep up with the rapid amount of changing and amendments to that bill. I think the important components are: 1, build an economy that is sustainable moving forward; 2, link to California's cap and invest system to have a larger marketplace; and 3, be really clear about the rules. I think there were a lot of exceptions in there, phase in and phase out. So I would like to simplify. And I wonder, my hope is during an economic downturn, the government can step in and invest in public infrastructure projects. Keynesian economic principles are important to increase demand at this time. If we're building things and creating infrastructure projects to get people back to work, why don't we do that in a sustainable way? And so I think that's a huge opportunity, and I would absolutely work towards building that more sustainable future.
Thank you.
And Helen, here's where I'm going to jump off for the news meeting. So thank you, candidates, for your time.
Thanks so much.
Thank you. Appreciate you.
Great. This question goes to Andy. Oregon's educational system has been known for years for having a low graduation rate and high chronic absenteeism. In the past few biennia, the amount of education funding has actually increased. So what's the problem? Why is Oregon not doing a better job in closing the achievement gap for underserved students and improving outcomes for all of Oregon's students?
Well, thank you. And I teach education policy courses, so I can go on at length. I'll try to keep this brief. I think we can change our accountability system, because our accountability system right now is based on a testing system that students do not take seriously. It does not give feedback to schools for 6 months. And by the time schools get information, the students have new teachers. So we're not using that data in productive ways. Second, I think our governance system is broken. Ever since we got rid of the state secretary of education, it seems like every 2 years the governor reconfigures the governance structure at the state level. I think Massachusetts has a really good model where the Board of Education then appoints a Secretary of Education. That provides a little bit more continuity in policy, and that's really important. Lastly, I'll just mention we have really high child hunger rates. We have really high child houselessness rates, and we have to invest in early childhood. Part of that is a healthcare story, part of that is a preschool story, but those lack of investments really are seen throughout our system. And just an interesting note, actually, I think I read this in the Oregonian, graduating high school seniors today entered kindergarten in 2007. So they were basically recession kids almost all the way through. And so we have done a good job at increasing funding in recent years. We have to continue those investments. Because our education system and our accountability system is not providing the results that this investment has wanted. And so my career has been studying education accountability systems at the state level, and I feel really prepared on day one to help push the conversation about how to improve performance in our schools.
Great, thank you. So in terms of, just to follow up a little bit more, you noted about the need to have greater investments in early childhood and other supports. But I guess why, haven't we seen I guess, what would you say has been holding the system back? I mean, is there, you talked about, for instance, appointing a Secretary of Education. I mean, is this something like where it's a lack of coordination across the state by DOE? Or, I mean, are there, you noted testing, but that's just kind of one element about what goes on in schools. I guess, what is, where is the state falling short? Is this the part of the state? Is it local officials?
I think as a state, Oregon's data system is really far behind. So students that transfer schools, the new school doesn't get information about that student. And so the first month or two, that school then tests that student to figure out where they should be. For example, on the teacher retention side of things, we could do more to increase working conditions and make sure that our teachers are staying in our classrooms. Teachers are the most important in-school factor in student achievement. And so I think there's some things we could do there. But I think the continuity piece, particularly around policy at the state level, is lacking. And again, I just want to return to, once we got rid of the statewide superintendent role, and I'm not advocating go back to that system, what I'm saying is we have not had a lot of continuity in our policy making, and teachers feel that when the curriculum changes, when the testing changes, there's a lag in terms of keeping up with that change. And we have not consistently had a course set out that we're confident in. And I think, there's a bipartisan support for really investing in education over the last few years. And I was really encouraged that the business community came to the table and really worked through increasing our investment. That said, we're still not at the quality education model. And so I do think we need to recognize that if we don't invest, particularly throughout the 90s, there are consequences of those decisions. And we're seeing those consequences in graduation rates, and we're seeing those consequences in poverty and homelessness rates as well, unfortunately.
Okay, great. Let's see, Maxine, same question for you. Oregon's educational system has been known for years for having a low graduation rate and high chronic absenteeism. Yet at the same time, budgets over the past few biennia have been increasing. Why is Oregon failing to close the achievement gap with students with underserved students, and why is it not doing a better job of improving outcomes for all of Oregon students?
Great. So this is key to the outcomes of a healthy community. We have to have an education system that works for everyone. What we see right now is disproportionate success in some areas and disproportionate lack of success in underinvested, historically marginalized communities. And so I think the testing structure such as that we have has enabled, as well as our ability to raise funds at a really local level for schools, that we have continued to invest in the more privileged populations of our state. We have to bring stakeholders to the table and ask them, why are you dropping out of school? Why are you not coming to school? And the great majority of the time when you ask people what they need, it is simpler than the system that we are trying to build to address it. And I believe local control to a large degree on a community level has to be facilitated with accountability and transparency. So we do need data. We need to reinvest in programs that work. We need to cascade learning from innovations at different local levels and then build it across the state. We have to show our work. How do you show that we are making inroads towards success? It's through data collection, and that shouldn't be on the backs of students being able to show up rested, fed, and in a place where they're ready to be tested. I think this is a much broader context. So support for teachers, support for families, and then community investment to allow focused, culturally sensitive investment to allow communities to help direct. Now, do I mean that everyone should be autonomous and not accountable? Not at all. But I know from having run a very large, complex organization, help running it from a governance perspective, that you don't have to reinvent the wheel every time. There are good programs that are working, and we know first and foremost, investing in young children, preparing them to learn, is going to predict outcomes that are much more successful than the later stream investments. So early education, preparation for kindergarten. I myself grew up in a family that no one had been educated. The only books that we had in our house were the little golden books that we got at my pediatrician's office at our well child checks. That I didn't know what a book was except for that. And I learned to read because my father got the Seattle Times every day and I had access to a newspaper. We don't necessarily look at the small things. Kids are invested, they're curious, they want to learn. And so we just need to facilitate making sure that they have the tools to show up at school ready to do that. And teachers have the ability to direct investment if we have a community that has wraparound supports to help those families. It really is a family-centered refocus, I think, that will help all of our students do better.
Helen, can I just follow up on one thing real quick?
Sure.
I think one of the lessons from the Great Recession was we have to be really careful as policymakers, because the opportunity gap actually both racially and socioeconomically grew during the recession. And as I talk to the community about now we're doing this distance learning thing and families are trying to learn how to support their students, I have a huge concern about the disparities growing. So I think at a state level, we really have to invest in things like technology and ways of working with parents who are single parent families or have English language proficiency, things of that nature. Because if we're not careful, this disparity will actually grow through this economic difficulty. And so I think as we look to the fall with our education policy in particular, we're gonna have to be really creative and learn from the last recession if we don't want to exacerbate these inequalities.
Great, thank you. Excuse me, this question goes to you, Andy. Oregon is as you know, there's a housing affordability crunch and a lack of general housing. Economists estimate that Oregon is has tens of thousands fewer units than needed to meet demand. What do you think the state should be doing to rectify that?
Excellent question. And the day I decided I was going to run was about 9 months ago. And I took my 3-year-old and 2-year-old on the Max, and we were walking around downtown. They love trains more than anything. And my 3-year-old grabbed my arm and said, "Daddy, why are there tents everywhere?" And it was a sobering conversation. I went home that evening and just really spent some time reflecting on the state of our community. And that was before the pandemic. So I have done everything I can to learn about our housing crisis. I went to the housing summit that was put on in Salem a few months ago, and have really prioritized listening to the various people at every level of working within the housing community to understand this problem. Here's what I've learned. One, we are not building enough housing, that our population is increasing a lot more than the supply. And so we have to do everything we can at the government to allow developers to build affordable housing. I think part of the zoning changes were good, but I've talked to some developers that say, I'm looking to build an affordable housing unit. It has 30 units in it. This is a 3 to 4 year project before I break ground because of all the permitting and regulation. And so what I would like to see is the government locally and even statewide try to bifurcate and speed up a process for affordable housing, because the crisis is now. I don't think we want to have a long, arduous process for folks who are trying to meet a need for a really basic necessity. So I think that's number one. Number two, the charges, the SDCs, that for new homes is a flat fee. I would stagger that. Some communities have waived that for affordable housing. I think we have to provide incentives, again, for folks to build affordable housing, because if you don't have an incentive and folks can make $500,000 more by building, upper income housing, it makes sense from a business perspective that they're going to do that. So I think we have to focus on that. And then the third thing I would say is I think we do need more housing vouchers. That is, direct payments to individuals to offset the cost of housing. Our population has increased and demand is higher than supply. And anytime that happens, prices are going to go up. And so housing vouchers, I think, are a really good solution, and direct payments to folks to offset the cost of housing is preferable and something we should look at the state level.
Great, thank you. Maxine, would you like me to try to attempt to repeat my question? Basically, it's just that we're in a housing crunch. We have a severe affordability problem across the state, and economists estimate that we have tens of thousands fewer units than needed to meet demand. What should the state be doing to rectify that situation?
Yeah, absolutely. So first and foremost, we have to have supply. We have a supply of high-income housing. We do not have a supply of low-income housing. So statewide, we need to focus on infrastructure around the transportation hubs. We need to find housing where people work or how they can easily get to work. So I would love to see us facilitating and expediting the permitting process for small units, affordable, with access to all those resources that we need. So really thinking about urban planning in a way that not just creates housing, but creates communities where people can be autonomous and really engaged in the group where they are. So how do you build these great communities? There's the Stapleton rebuild area in Denver that really focused on walkability and businesses, and it's a fantastic model. That was a public-private partnership, and I think that really facilitating investment in urban core, as well as reaching out along the arterials to how people get to work so that we can minimize impact environmentally as well. We really need to focus on how people get to work, not just whether they can afford to live. Statewide rent assistance has to be part of that, and facilitating permitting. I absolutely agree that there are way too many hurdles, and those hurdles are harder for innovative shared housing, supportive housing. We don't need to have the traditional 5,000 square feet as the American dream. I think that we need to re-envision a future where the American dream is really about living in a place that you have access to open space, good schools, safe environment, and transportation. And it doesn't mean that you have to have a huge home to do that. So decreasing our impact on the environment while we create desirable communities in places that are accessible to all, and incentivizing that in a streamlined way so that people can get going on it and make it affordable. I would love for us to not just focus on short-term housing, but really sustained building of investment for families as well. A lot of families, the most valuable asset they have is their home, and the ability to buy a first home is disproportionately in white, wealthier communities. And so I would like to have programs that really give incentives for smaller local banking institutions and financial institutions to facilitate home ownership for those who've been left out.
Great, thank you. One other area I wanted to delve into was the Oregon Health Plan and a long-term funding solution for it. Right now, it gets federal dollars in part by taxing the health plans of individuals, groups, and also just in terms of the public employee healthcare plans, so that, for instance, educational systems are paying this tax, while employees who work for large companies like Nike, the Oregonian, others, they're not taxed to pay for Medicaid. The state's also looking at the tobacco tax as a way to help increase funding for it. Is this a sustainable way of funding Medicaid? Does there need to be some different kind of approach? And if so, do you have any ideas on that? And I'm sorry, Maxine, you be first.
Yeah, no, thank you. And this is where I really want to focus on the efforts of my legislative career. We have enormous potential, and I'm so excited to hear the insight that you have, because I think a lot of people don't understand that. I'll address the first part of your question about the premium tax. Those who aren't paying a premium for their employees aren't paying that tax. So those companies who are paying a premium, even healthcare organizations who are buying their own insurance for their employees are paying an extra premium tax. And that is then being applied to Medicaid. So the companies, as you said, who are self-insured don't have to pay that tax. And that is a loophole that I think we absolutely have to close. We can do that by having a public option that is portable and affordable and on a sliding scale. And if our employment could be decoupled from our health insurance, we would decrease the immediate double hit vulnerability that people have when they lose their health insurance. So this is a multifaceted plan, but the first one is we need to close that premium tax loophole to get all companies who are already providing care to their employees. I would then use that to help incentivize, if you're not paying a premium and you actually could use a health savings account to put in the amount that an employee could use to buy independently the Medicaid expansion, Oregon Health Plan for All. If they could do that and sustainably have the same healthcare provider, the same care delivery organization, and effectively have a card that they could go wherever they want with their medical record, we could open up a truly competitive market, and people will get the care where they enjoy the care that they want. And if the healthcare itself is streamlined, it will be less costly. Finally, we have a huge number of people who are being subsidized by the employers are being subsidized for their employment or their employee base by Medicaid and other social services. So companies who don't offer universal health care to their employees, which many can't, it is incredibly expensive, and you can't. I've run a company, I understand the healthcare premiums, you have no control over it. If you suddenly have a narrow margin business and you have a 12% premium increase, how do you balance that? It's really unaffordable. So we get to this place where we are with high deductible plans and large percentages of the premium costs really going to the employees, and we need to uncouple that. So, or decouple that by, if you don't provide care, I would advance a statewide taxation policy that all those payments are then being put into the Medicaid expansion program. So you can choose to either provide care, or you can choose to pay a tax to have the state effectively subsidize your employee base.
Great, thank you. Andy, same question for you. Just in terms of Medicare right now is funded through a variety of primarily federal funding, but also from taxes on select groups who are not self-insured. Is there, do you have any thoughts in terms of a more sustainable way or a more equitable way of funding Medicaid so that all Oregonians can be covered whether or not they have health insurance through their employer?
Yeah, thank you for the question. And I spent a lot of time learning about the intersection between policy areas, and actually had an opportunity to get a grant and study Medicaid waivers vis-a-vis education waivers and welfare waivers. So this relationship between the state and government is one of my expertise in my research. For perspective, we should not be talking about how to get more money into the system, a system that at every level profits off of people being sick. And so I think what we need to do is expand Medicaid and have a public option and price it 20% lower than other plans, 10% lower, and try to incentivize folks to go into that plan because our system is drawing resources away from housing, drawing resources away from education, all the things that create a healthier society. And so I don't think we should be talking about how to get more money into a system that as we give more and more money, we get worse outcomes. For the past 2 years, we've seen life expectancy in the country drop. Maternal healthcare outcomes have dropped as well, particularly in African-American women. I think we have to shift the discussion to how can we create a more financially sustainable model. because the current system, almost at every level, is not just not financially sustainable, it's really profiteering off of people being sick or hurt.
And I just want to, if I can, Helen, say that I hope I didn't lead to think that I was trying to increase investment in this. I absolutely agree that we already have sufficient funding. That's what I was trying to get to, that 27% of our budget is already going as a state to this, but individuals are paying this. If we take for granted that healthcare is a human right and that whatever we're paying into that system, from a premium, copay, whatever those costs are, if we can start thinking of those as individual taxes, which effectively they are, then people are paying far more for healthcare as individuals as well as a state than would be the outcome if we can expand and have a port.
Hi, Maxine.
Hi, I'm so sorry. I don't know what happened.
No worries. We were just talking about that. We've had good technological karma for the past week, so something had to go wrong.
Oh my gosh, that's terrible.
Well, I think, how about if we have Andy just give kind of some final thoughts, and then you can weigh in if you want to kind of pick up where you left off or go, however you want to handle it is fine.
Sure,
okay,
thank you.
Great. Okay, Andy, how about you? Can you tell us, is there anything else that you want to make sure to talk about today?
Sure. Well, I really appreciate your time, and thank you again for all that you do. I just want to emphasize a couple of things that help me stand out in this race. First, my wife and I grew up in this community and have really deep roots and are raising our kids in the community that we grew up in. Second, I'm the only candidate in this race to have served in elected office, and we really need individuals from day one to be able to address this critical time in our state and nation's history. Third, I have a really broad coalition of support. That I have folks from the United Farm Workers to the Beaverton Chamber of Commerce. The state senator from this area, Elizabeth Steiner Hayward, is mentoring me through this process. And I feel very confident that she will help me from day one understand the budget. I mean, she's a budget person as well as co-chair of Ways and Means. And so I feel very confident about the coalition I have. And finally, I'm the only candidate from Washington County, and the majority of House District 33 is in Washington County. Cedar Mill Bethany is a very unique area. We're unincorporated Washington County, which means that we don't have a city government, and as a result, we really rely on county services. So I'm really hoping to bring a voice to all of House District 33, but especially to the unincorporated Washington County portions that don't have as much representation as Portland does in Salem. So thank you again for your time. It's wonderful. Really enjoyed this conversation, and hope everyone stays safe and healthy.
Great, thank you very much. Maxine, do you want to give some closing thoughts?
Sure, thank you. And again, I apologize for being booted off there. I have no idea what happened. So first and foremost, this is an important election. It's one that clearly this seat has historically been one that has focused on healthcare for the last 20 years. And we have a dearth of healthcare expertise in our state legislature. At this point, we are losing Mitch Greenlick, who's really been one of the most influential navigators of healthcare policy for our state. And so what I bring to this race is clearly healthcare expertise, but also balanced with life experience of not having the privilege that many have, and certainly the privilege that I want to see all communities, not who look white like me, but all communities need to be engaged in our policy making. So real stakeholder engagement, and then building, mentoring future leaders to broadly represent the most diverse county that is Washington County. We absolutely need to have representation that appropriately reflects the people. And so what I've done in my life is, one, overcome insurmountable challenges that have been because of a resilient community. So we need to really focus on building resilience in our communities. We need to focus on the social determinants of health. And if we can do that effectively, we will have a community that everyone can be successful in and everyone can achieve their goals. And having come from that perspective can see that. And then as a physician, I talk to people every single day about their struggles, whether it's with addiction, mental health, housing. We do social histories every day. I see the impacts of the policies that we create. It's not theoretical for me. I will know, with the hundreds of people that I take care of in a month, what those policies are looking like for them. And it really is that people focus that I can bring to this race. And then having had, I was chair of a board of directors of a physician corporation. I know margins. I understand how business works. I've led our group to be the first physician corporation to be a B corporation in the world that is mission-driven business using their force for good. And that is really where I think we need to be, is that we are all Oregonians. We need to reinvest in our communities. And I think each and every level wants to do that, whether it's our frontline workers who are now at the front of COVID-19, or it's the large organizations who need a healthy workforce. If we all can focus on the outcomes of supporting people and building resilient communities, I believe that we all want the same things. We just have to go across all areas to find the innovative ideas, and bringing stakeholders who really live in our communities to the table. It's a privileged place that we have, and having the ability to hear people, giving them the support so that they have childcare, transportation, and language services to make sure that they can engage meaningfully in the conversations. We need to do that, because we have forgotten that the people who are impacted by the policies are the best able to help us understand how to build new policies. And that is something that I do every day, and it's what I'm committed to. My first priority is working families. Every policy that I vote for, I want to ask myself the question, will working families be better off as a result of this policy, yes or no? And the answer really has to be yes. Next is environmental policy, and I'm not saying these in order. These are the three principles that I'm going to lead on. Next is environment. We have to have a healthy environment. Our kids are growing up with an existential crisis that none of us have ever really understood before. So we have to put environmental policy top. And then healthcare. If we don't have people who are healthy and stable, they can't engage in the economy. And we have to really refocus on using the money that we are pouring in ineffectively to healthcare, and refocus that on the public health infrastructure, the social infrastructure around our families, and the community-based organizations that interface with it. And if we have a public single-payer healthcare option, we can build that, because the perverse incentives that currently dictate how our healthcare industry operates will be gone. And I believe that this is the time, this is our opportunity, and we need to embrace it.
Great. Thank you so much, both of you, for taking the time to talk with us today. This was a really, really great conversation, and you've given us a lot to think about. So I appreciate it. We will be issuing our endorsements on Sunday, I believe. And if we have any other questions, we'll follow up. But thanks so much, and hope you all get a chance to, there's a little bit of sun. Great.
Thank you. I really appreciate all your time.
Sure, no
Thank you.
problem.
Have a
Take
wonderful
care.
day.
Thanks.
Yep.
You too.
Bye.
Thanks.